Senator McDonald.
Mr Acting Deputy President, I'm absolutely amazed that the Labor Party would raise for debate the issue of Medicare after the disgraceful lying campaign conducted by the Labor Party and their union mates at the last election, when union thugs were standing on the pre-poll queues saying, and they picked their mark, Mr Deputy Chairman, they'd picked their mark, older people, ladies, frail ladies, they'd rush up to and say the Liberals are going to abandon Medicare. And this continued on, an outright and complete and absolute lie that the Labor Party will forever stand condemned for. And I might say, Mr Acting Deputy President, this CPSU union lady who was doing this, when I went and stood next to her and when she'd threatened this elderly person, I'd say to her, "Excuse me, madam, what you've just heard is a complete fabrication. The government is not selling Medicare." This CPSU lady, and I say this because of those opposite now, would say to me, "You're bullying me." And I said, "Hang on, I'm bullying you. I'm simply talking to this lady, telling her the truth. You're bullying me. You're standing in my space," she'd say. So I assume that's the new union way. If someone challenges them, and particularly if they happen to be a female, the retort is, "Oh, you're bullying me," where in this case the bullying was being done by this CPSU lady picking on vulnerable, frail people and telling them abject and absolute lies. Now, Mr Acting Deputy President, in debates such as this, it always is useful to have a little bit of fact. What you heard from the previous Labor Party Speaker was just a conflagration of lies, mistruths and misinformation. Now, let me give you the real facts. Mr Acting Deputy President, the coalition government is investing $22 billion in Medicare, over $1 billion more than last year. This will increase to nearly $26 billion additional in 2019-2020. Mr Acting Deputy President, again to put the lie to those comments made by the previous speaker, bulk billing rates are the highest they have ever been, ever. GP bulk billing rates is at over 85% compared to when Labor was in power, that is the people who proposed this motion, when they were in power the average rates were 79%. I'll repeat those, Mr Acting Deputy President. Under the coalition, 85% GP bulk billing rate, under Labor 79%. Mr Acting Deputy President, across Australia in the last financial year, there were 17 million more bulk billed GP attendances than in Labor's last year in office. Now again, I'll repeat that because those listening to this broadcast might want to have the facts. They might want to have the facts rather than the lies that were told by other speakers previously. I'll repeat them. 17 million more bulk billed GP attendances compared to Labor's last full year in office. More people than ever are seeing a general practitioner, a doctor, without having to pay anything. And Mr Acting Deputy President, to continue some factual input into this debate, can I talk about the pharmaceutical benefit scheme that was mentioned by the previous speaker? And I want to mention that because I'm particularly proud of the way our government has listed new medicines for melanoma, cancer, cystic fibrosis and a cure for hepatitis C in the term of this government. Many of these medicines would have cost people tens if not hundreds of thousands of dollars a year, but we've been able to list them so they only cost now $38 or $6 for a concession script. And Mr Acting Deputy President, I was particularly involved in the hepatitis C campaign, as was my colleague Senator Dean Smith, who I might say took a lead in it. But I had a relative who had hepatitis C and who went through 48 weeks of sheer agony in an old form of possible treatment. For him, I'm pleased to say it did work, but he went through agony, he and his family and his children. The government has since allowed on the PBS this new scheme, which you take one pill for 12 weeks and it's almost a guaranteed cure. I was told when the pharmaceutical companies were coming to me lobbying to get this onto the PBS, that the treatment would have been in the range of, they're a bit coy about the actual cost, but somewhere between $70,000 and $100,000 was the cost of this drug. You can now get it, thanks to the coalition government, for just $38, and for those with hepatitis C, it's almost a cure. Mr Acting Deputy President, in addition to that, in the coalition government's first 3 years, 1,000 new medicines have been approved for the pharmaceutical benefit scheme, and that's worth some $4.4 billion. Can I just compare this? I'll remind you, 1,000 in 3 years under the coalition. Can I compare this with under Labor's last three years? There were 331 new medicines on the PBS. So if you'd taken any notice, and I'm sure not many people did, of the previous speaker, you'd think that the health system was in chaos. But there we are under Labor, 331 new medicines in 3 years on the PBS. Under the coalition, 3 times that. 3 times that. Mr Acting Deputy President, not only are more medicines available, they are now cheaper. In an Australian first, the price of a large proportion of expensive combination medicines and patent-protected drugs on the PBS have reduced by as much as $20 under the coalition. On the 1st of October this year, more than 2,000 medicine brands treating common conditions dropped in price for millions of Australians. And I have to say, Mr Acting Deputy President, the Liberal and National parties are the only political parties with a plan. Our economic plan will enable us to pay for Medicare so Australians can continue to receive the health care they do now and into the future. And can I just emphasise that, Mr Acting Deputy President? Labor will talk about these things, they'll throw promises around as they're good at doing. They never have any concept of how they're going to pay for it. And under Labor, and this is an historic fact, under Labor the economy goes backwards, taxes go upwards and Australians suffer. You have to have a change of government every now and again to get the economy back on track. Why do we want the economy back on track, Mr Acting Deputy President? We want it back on track so the government can be in surplus and can spend money on what Australians want, and that is a decent health system, which they never got under Labor. All congratulations to Minister Susan Ley. She's done a wonderful job. And these people can argue with me, members of the Labor Party. 1,000 new medicines under coalition, 300 under Labor. Come on, let me have the argument. There are 17 million more people getting the GP services free under the coalition than under the last year of Labor. Argue with those facts and see where they go. Under this government, we care about health, we care about Medicare, we will continue to invest in Medicare to the benefit of all Australians, and we'll do that because we are getting the economy back on track and can afford it as a nation.